other amazing professionals that share my love of educating the community on all things mental health. So 4 of us got together, we collaborated, and we thought, wouldn't it be great to create speaker series events where we could all come together and learn about various topics that are affecting our community. So the next 3 people that I'll introduce are sponsors of these events. So I'm going to turn it over to the Director of Outreach, Stephanie Alexander from Fusion Academy, to introduce herself and the program that she sponsors.
Everyone, like Elizabeth said, thank you so much for that lovely introduction. I am Director of Outreach. I'm relatively new to my role, so I see some faces or names that I recognize, but I have not met yet. So don't worry, you're on my list, I'm sure. So I'm with Fusion Academy, and I'm the Director of Outreach for the Galleria and Sugarland locations. I have a counterpart who is also taking care of the Woodlands campus. And we are a one-to-one personalized education school. So fully accredited, and we with middle school and high school students. So a lot of kiddos who struggle sometimes with mental health, but then we also have our bright, gifted as well, mix in between. So we take care of anyone who basically will flourish in the non-traditional school setting. So I will go ahead and introduce our new head of school, Julie Garcia, as well.
Sorry, I was trying to unmute myself, right? The trend of 2020. Stephanie Alexander did a great job of introducing school at Fusion. I am your head of school. Just wanted to say hello. Thank you for being here. And I'm looking forward to another great conversation with Dr. Ron. Thank you. Who's next?
Stephanie, also let you guys know something. Sherry with School of the Woods is going to be referring somebody to you. I made that recommendation.
Sherry, you are great to hear.
Great connection.
Awesome. The next person I'd love to introduce is Julie Pomerantz, and she is with the Hub.
Hi, everybody. Thank you all so much for being here today, and thank you to Elizabeth, Dr. Ron, Fusion, etc., for this wonderful collaboration. My name is Julie Pomerantz. I'm the Director of Admissions and Outreach at the Hub Houston. We are 3 distinct programs I'll cover super quickly. We do have a high school program, but we're able to start at about the age of 13 on up. Not all, but most of our high school students do fall on the autism spectrum. We also have students at the Hub who have ADHD, autism, I mentioned that already, depression, anxiety, any at all students that might want to be in just a very, very small nurturing setting. Besides our high school, and we are in Northwest Houston, we also have a separate campus a mile away from our high school called Life 101. This is a program for young adults over the age of 18, where we work on employability skills, life skills, social skills. We'll help them launch into their next chapter in their life, whether it be if they're in junior college, we can help them with their academics assignments or help them get an internship, a job, a trade, any at all that they need. And finally, our last program is Club Hub, which is also teen and over. This is a program that is strictly social, 3 nights a week, where they can come together, form relationships, make friendships. Again, it's about helping that population move on to their next chapter in life. Thank you, guys.
We miss Coach.
I know she is supposed to be on. So Coach, who is Colleen Russo, better known as Coach, she is on another call, but is going to come on as quickly as she can. She's the executive director and founder.
Awesome. Thank you, Julie. So next we have Pam Esser, and she is with ADA.
Hello, everyone. Good morning. Beautiful sunny day for a change. It's nice. As Elizabeth said, I'm director of ADA Southern Region, the community for about 33 years. Our main focus is support groups and education. We have about 9 meetings, and we're hoping to have those start again fall. But for right now, we're doing 3 virtual support groups and supporting Dr. Ron's presentation. So we're things to choose from per month. And we hope to begin having some other virtual presentations probably after 2 months. So please check us out. We also help with referrals, resources. And so we try to work with ADHD and associated disorders. So check us out, and I'll put my email and information in chat. I have a dog that had surgery, so I probably won't be hanging on camera. So thank you.
Thank you, Pam. Appreciate it. Okay, so before I turn it over to the main events, to our main speaker, Ron, we have some little housekeeping rules that I would love for you all to participate in. You register for this event, and one of the great benefits of registering for this event is that you have access to the recording of today's presentation as well as the PowerPoint. In order to get the information to you, we need you to put your name in the chat box along with your, just to confirm your registration. So whatever email you use to register, make sure you put that in the chat box, and we will make sure we get this information to you. Again, we have that same love and passion to make sure. Sorry, that just went off the rails. My mute button. So sorry. Like,
I wonder
Julie
what
said,
happened to that. I thought it was mine.
that it's 2021. That's all they got. We have a couple of housekeeping items. Make sure you put your name and email in the chat box so that we're able to capture your name and registration for today. And that way we can send you out the presentation, both in video form and PowerPoint. That's one of the great benefits of being able to be part of the Dr. Ron Speaker Series event. So we're making sure that we capture the information. So make sure you sign your name and your email in which you registered for the event. And I'll say it again at the end, these are monthly speaker series. So we have one that's coming next month. Next month is your brain summer ready? So we've got summer coming up. It's just around the corner. So is your child ready for summer? How can we help with that? So make sure, again, you're signing up so that we can get you to the next event. So I turn it over to Dr. Ron. I'm so excited to hear you speak today, and I'll allow him to introduce himself. Thank you.
Hi, everyone. I'm Dr. Swatzyna. I run the Houston Neuroscience Brain Center. I've been in the area, for those that don't know me, for going on years now. And I work for the Tarnell Center for Self-Management up until December of 2019, and have had the opportunity now to run my own center, and this I love a lot. Now, I've treated autistic children, the capture of this meeting today, pretty excessively. At the Tarnell Center, we got a lot of autistic kids in, and this has become my area of clinical research. I've published 4 articles on 4 studies I completed on autism, and this is what we're going to talk about today, and then we're going to open it up because I think this population is very understood, misunderstood, and misdiagnosed, and we'll get into it. Let me blow my screen up here. All right, let's see if this works. Hi, it does work. Great. We're going to go over the causes, the prevalence, and the treatment today. Talk about the contributing factors, the diagnosis of autism, the prevalence in different populations of how it can be misdiagnosed, and the treatment considerations, because autism is not easily treated, as you guys well know. Why is the prevalence of autism increasing? We hear this all the time, that ADHD and autism both are increasing, and it's kind of curious. So a colleague that I've had the pleasure to meet, offer our assistance in some research that he's doing, Enzo Grassi from Italy, over in the Murano area. He has an institute over there, and he's been doing some research with machine learning and artificial intelligence in autism. And he published a paper recently, and I'd like to show you this chart here. This is the latest. It was 2018 publication, And it shows, if you see autism right down here in the crux of where everything comes together, you got three basic legs that contribute to it. And to make it all simple, rather than have you try to figure out everything about this, and you guys can get a copy of this PowerPoint, that's no big deal. That guy is smoking during pregnancy seems to be linked to smoking at conception, seems to be linked to cesarean delivery, and is linked to pregnancy complications and then to autism. So that's how that one leg goes. Dystocia delivery is a delivery that's, shoulder first, butt first, whatever. It's not a good delivery. Linked to postpartum depression, linked to no breastfeeding, and then linked to autism. That's kind of an interesting little link there. And then it says here, 4 stressful events converging to solvents or paint exposure during pregnancy and then to autism. So this solvents and paint exposure for women in the workplace, that seems to be something that has been brought up and researched over the past 5 years. So, we wonder why autism is possibly increasing. And I think it's because we're possibly living in a more toxic environment than we were years ago. So I think that's where it all comes. All right. Other factors in autism: breastfeeding, absence, and early antibiotic use are close to the autism spectrum node. So breastfeeding and early antibiotics, I said there is unanimous consent around vaginal delivery and breastfeeding providing the most appropriate bacterial substrate for the development of the psychological gut flora. So I think that's something that we know. There's a lot of women out there that are having cesarean electively instead of vaginal births. And wisely, I think they are actually introducing the vaginal secretions as the gut flora into the mouths of these little babies. And I think they're taking care of the problem on a cesarean delivery. So, but I think it's really critical to know we're always seeing how many issues these children with autism have of irritable bowel and, very picky eaters, just all sort of inflammation in their guts. And I think it has to do originally because a lot of the births that we see are all cesarean, and they are missing this valuable piece, the breastfeeding piece and the vaginal delivery. Autism diagnosis is based on 3 primary issues: a language issue, a social issue, and repetitive behavior, okay? And that you can get diagnosed as autism, but you and I all know that the true autistic child is very identifiable, but a lot of children that have autism, it's, I don't really know if that's an autistic case. And when I see something like that, I'm always going, well, it may be a misdiagnosis. For sure, you can't cure autism. I'll say that up front. You can make the symptoms better, but you can't cure it. And we've had kids that come into our diagnosed with autism and they leave our center no longer diagnosed with them. Did we cure autism? No, we didn't. I think it was just misdiagnosed from the beginning. But I understand parents' position in this because realistically speaking, you can get a lot of accommodations for a child that's diagnosed with autism where accommodations for other areas are not so forthcoming in the educational industry. So here's the research that I've done on autism. And like I say, you guys can get a copy of these presentations and just email me and I'll have all that provided. Alexander, can you put up contact information, office information, and everything for us so they'll have it in chat? Alexander is my main go-to here. Okay, we're going to watch a video.
When I was 10 years old, a cousin of mine took me on a tour of his medical school. And as a special treat, he took me to the pathology lab and took a real human brain out of the jar and placed it in my hands. And there it was, the seat of human consciousness, the powerhouse of the human body sitting in my hands. And that day I knew that when I grew up, I was going to become a brain doctor, scientist, something or the other. Years later, when I finally grew up, my dream came true. And it was while I was doing my Ph.D. on the neurological causes of dyslexia in children that I encountered a startling fact that I'd like to share with you all today. It is estimated that 1 in 6 children, that's 1 in 6 children, suffer from some developmental disorder. This is a disorder that retards mental development in the child and causes permanent mental impairments, which means that each and every one of you here today knows at least one child that is suffering from a developmental disorder. But here's what really perplexed me. Despite the fact that each and every one of these disorders originates in the brain, most of these disorders are diagnosed solely on the basis of observable behavior. But diagnosing a brain disorder without actually looking at the brain is analogous to treating a patient with a heart problem based on their physical symptoms without even doing an ECG or a chest X-ray to look at the heart. It seemed so intuitive to me. To diagnose and treat a brain disorder accurately, it would be necessary to look at the brain directly. Looking at behavior alone can miss a vital piece of the puzzle and provide an incomplete or even a misleading picture of the child's problems. Yet, despite all the advances in medical technology, the diagnosis of brain disorders in 1 in 6 children still remained so limited. And then I came across a team at Harvard University that had taken one such advanced medical technology and finally applied it, instead of in brain research, towards diagnosing brain disorders in children. Their groundbreaking technology records the EEG, or the electrical activity of the brain, in real time, allowing us to watch the brain as it performs various functions and then detect even the slightest abnormality in any of these functions: vision, attention, language, audition. A program called Brain Electrical Activity Mapping then triangulates the source of that abnormality in the brain. And another program called Statistical Probability Mapping then performs mathematical calculations to determine whether any of these abnormalities are clinically significant, allowing us to provide a much more accurate neurological diagnosis of the child's symptoms. And so I became the head of neurophysiology for the clinical arm of this team, and was finally able to use this technology towards actually helping children with brain disorders. And I'm happy to say that I'm now in the process of setting up this technology here in India. I'd like to tell you about one such child whose story was also covered by ABC News. 7-year-old Justin Senegar came to our clinic with this diagnosis of very severe autism. Like many autistic children, his mind was locked inside his body. There were moments when he would actually space out for seconds at a time. And the doctors told his parents he was never going to be able to communicate or interact socially, and he would probably never have too much language. When we used this groundbreaking EEG technology to actually look at Justin's brain, the results were startling. It turned out that Justin was almost certainly not autistic. He was suffering from brain seizures that were impossible to see with the naked eye, but that were actually causing symptoms that mimicked those of autism. After Justin was given anti-seizure medication, the change in him was amazing. Within a period of 60 days, his vocabulary went from 2 to 3 words to 300 words. And his communication and social interaction were improved so dramatically that he was enrolled into a regular school and even became a karate super champ. Research shows that 50% of children, almost 50% of children diagnosed with autism, are actually suffering from hidden brain seizures. These are the faces of the children that I have tested with stories just like Justin. All these children came to our clinic with a diagnosis of autism, attention deficit disorder, mental retardation, language problems. Instead, Our EEG scans revealed very specific problems hidden within their brains that couldn't possibly have been detected by their behavioral assessments. So these EEG scans enabled us to provide these children with a much more accurate neurological diagnosis and much more targeted treatment. For too long now, children with developmental disorders have suffered from misdiagnosis while their real problems have gone undetected and left to worsen. And for too long, these children and their parents have suffered undue frustration and desperation. But we are now in a new era of neuroscience, one in which we can finally look directly at brain function in real time with no risks and no side effects, non-invasively, and find the true source of so many disabilities in children. So if I could inspire even a fraction of you in the audience today to share this pioneering diagnostic approach with even one parent whose child is suffering from a developmental disorder, then perhaps one more puzzle in one more brain will be solved. One more mind will be unlocked, and one more child who has been misdiagnosed or even undiagnosed by the system will finally realize his or her true potential while there's still time for his or her brain to recover. And all this by simply watching the child's brainwaves. Thank you.
I think you're on mute, Dr. Ron.
I got it. I got it. I just had myself muted. So this is a population that I've treated for many years now, going on 2 decades. And I have really a soft spot for these autistic children. They are so disadvantaged in so many ways and so misunderstood. So what we don't want to do is misdiagnose them and let something that could have been easily alleviated be fixed. And so when we're talking about treating autistic children, normally they're all 60, 80% of them are comorbid with ADHD. So they start them out on stimulants. They go over to the SSRIs when their anxiety starts getting a little bit higher, or they start having a little bit of meltdowns, or they start some repetitive behavior, and then they'll hit it with the antipsychotics by the time they hit adolescence, young adolescence, when the hormones kick in and their behavior gets out of control. And the whole time, if they had these silent seizure brain spikes going on, we could have helped them through that. And we have seen quite a few children just make dramatic turnarounds with the right medication and treatment. We like to do the neurofeedback with it in conjunction with medication stabilizing the brain and the neurofeedback locking it in. So it's a great way to treat these individuals. And it's not a one size fits all. Everybody is an individual. Every brain's a slight bit different. So all the protocols set up are for that. Where we are. Okay, now I'm going to open it up for questions. I just want to do this brief little piece and see what the audience has to say out there.
Yes, we've got a lot of questions. And if you do have questions for Dr. Ron, I read them from the chat, so go ahead and put them in the chat. So a person wanted to know, is there a particular test asked for, medical codes? How can they request it for their child?
For their child, to do a EEG, quantitative EEG study, if you contact our office, and Alexandra should have put in the phone number there, we will give you the codes. What we would like to do, if they have a treating physician, primary care, or a pediatrician, or an adult psychiatrist, whoever, they want to, because they failed several medications, just have the doctor write on the prescription pad, request an EEG to rule out seizure activity. And that should usually get part of the study covered. So that would be the process. And I'd be glad to speak to him that wants to send me an email and talk about their particular case, and we can walk you through that before we get it started.
Great. Any recommendations for a shorter amount of EEG time where a 48-hour watch is not needed?
But we don't do a 48-hour EEG. We do in our office. We can be in and out, in and out. The neurology standard conventional EEG is 20 to 40 minutes, and that's what we collect. And the 5-year-old yesterday, he's 6 today, and he has tried it 3 other times, but we were able to get it without any problems. So no, we're not going to torture a child. I will not do that. There'll be no screaming going on for trying to get him to put the cap on in my office. So we'll do everything we can desensitize him, and even if it takes us to do that, we have training caps and things like that to help make it easier on him. And I'm trying to get a video together. One of the mothers did a video yesterday for her son. I think it was absolutely amazing. If I can get that video, I'll post it so people can show their child respect.
Awesome, thank you. Could you please define neurofeedback?
Neurofeedback uses operant conditioning. It's the same type of conditioning we use to learn to ride a bicycle or play the piano. We get the feedback visually and auditorily, and we usually use movie, Netflix, Disney Channel, something like this, DVDs, in order to train the brain. So what we do is on certain pieces of equipment, it's not doing what it's supposed to do. The picture goes back and the volume is down. When your brain's doing what it needs to fit the thresholds that we've set up, the volume comes back up and the picture is fully bright. So this way your brain wants to watch the movie, so it will figure out how to keep the movie going without you doing any manual adjustment to it. And so after doing this a period of time, 5 to 10 sessions, it sticks. It's like when you learn to ride a bicycle, it may be 20 or 30 years since you rode a bike, but you can get back on it. You still have pathways in order to ride the bike. It's about new pathways that are more functional than the pathways that you have now. I hope that's
Great. Thank you, Ron. What is the difference between EEG and QEEG?
We do EEGs. We collect EEG data in here just like neurologist offices do. Now, that EEG data is encrypted and then sent to a service that farms it out to the neurologist to get an EEG read, and then it farms it out to the Human Brain Institute in St. Petersburg, Russia, the highest trained doctors in the world, to do QEEG brain maps. They take that EEG signal, quantify it, run it against the normative database, come out in standard deviations, and then print up all these beautiful color maps to show how much you differentiate other children, other adults your age. So that's between the EEG and the QEEG.
Can you treat older teenagers?
I'd love to. We can treat any, and my success story with a 70-year-old in speeding up her brain a half a second in 40 sessions, that gave probably 5 more, 6 more years of cognitive functioning better than she had. So it was amazing that even a 76-year-old trains well. Youngest train really well. Any child can sabotage anything they don't want to do, but that very rarely happens because they all like watching movies. Pretty easy for them.
Yeah. Can autism be inherited?
I would say that the studies show that no, it's not necessarily inherited. There's not a gene for autism. I think it is a malformation in the time the mother's carrying the child. I bet older fathers over 40 have higher incidence of producing autistic children. So old sperm may have an issue, not so much old eggs, but old sperm is what the Israeli studies have found. So, but that's not really a genetic thing. That's just has to do with the condition of the sperm and the egg.
Okay. My child had an EEG for seizures for about 2 years. The results were not explained to me, just that she did not have a seizure. But I did not know if there was anything else to evaluate her on.
Well, that's what we don't really particularly care for when you go to a neurologist. A neurologist is looking for seizures or he's looking for tumors. And other than that, the epileptic formages that we can identify, the spike activity, would most often be called normal if it's not a true seizure. That's where if you go to a neurologist that is not board certified in encephalography, he won't have the training to look for abnormalities. That's where my team of neurologists do, and we make that distinction. I want to know every subtle abnormality. I don't care if it's in the normal population. It's my job as a clinician to show that it is linked to the presenting behavior or presenting. So there is a difference. If that mother would like, I would be happy to review those things and point out and maybe explain some of the findings. If they did have the subtle abnormalities identified in there, that wouldn't be a problem. I'd be happy to do that.
Great. How does this translate to adults? And does your office offer sedatives to complete EEGs?
No, we, again, if we have to, if the child just is not a habit, because there are a lot of just children in general can be hypersensitive to the teacher. We'll take time, meaning training the parents how to get the cap on and keeping the child with having the cap on for a period of time. We'll send ear clips home to desensitize them to the ear clips. But no, it's not an issue with getting children that are having difficulties. But I think there was a second part of that question about adults. What was that?
Use this for adults.
Yes, definitely, all the way up.
Yeah.
76-year-old, bring them on. We like
Yeah.
to see these brains. We're just looking at a study right now. We're getting ready to do the EEG reads for a pharmaceutical company that has an Alzheimer's and a Parkinson's drug they want to test, but they want to just rule out all the seizure activity so that they don't put them into. So we're actually started on that already.
Are there any other image recommendations for kids? What does a comprehensive testing of a child look like?
Well, we're bringing their imaging have a functional issue with the brain electrically that will never show up on an MRI, an MRA, or a CT or anything like that. If we do the EEG and our neurologist says he recommends an MRI, then he's suspecting that there is some indication that there is a structural abnormality that could be identified. So outside the EEG still remains the most sensitive to the function of the brain because you can have brains that are totally don't have any structural issues and would never show up on an MRI. And the second part of the question was?
What does a comprehensive testing of a child look like?
Okay, we bring them in and the actual person goes, their ears down with a little bit of alcohol, put a couple little ear clips on that will connect them to the computer, put a cap on them. You have a cap over there you can hand me, Alexandra? Put a cap on them, and the caps make it so much easier than going to a neurologist's office and put 19 different sites. This is one of the caps, one of the training caps. Inside you can see all the wires, all the buttons together with the little, every kid loves the rainbow umbilical cord and it goes into our computer. So that gets put on them, and then we actually gel up each little hole. Here is a grommet, and each of those little holes we got to put a little bit of gel into with a blunted needle. So there's no point on the needle, it's just used to squirt the gel into the hole. And it takes about 11 minutes with the eyes open and about 11 minutes with the eyes closed. And we have sleep masks to make it easier to keep their eyes closed. And I've seen a lot of children do much better than some of my assistants in doing their EEGs. Right, Alexandra? He was terrible.
Also, I put links to the website for the EEG and neurofeedback procedures where they can watch us do a video.
Okay, muted. But
Well,
yeah. She put links to the website. We have the video in there and everything. So it's in our chat. She just wanted to tell me.
Awesome. I get this one a lot. Do you take insurance?
No, we don't take insurance. We can give you the codes and the receipts that were the diagnosis and the CPT codes for the actual procedure, as they call them. And like the The cost of it is $1,440, which is a questionnaire that goes with you that actually built a set of brain maps on your answers. It includes follow-up or report feedback where we spend an hour talking about your particular case and treatment plan, thing we need to do from that. And so it's pretty comprehensive, and it's used in order to figure out what neurologically is causing symptoms, the person's symptoms. So the reimbursement on it on the EEG, if you get it prescribed by a neurologist or a psychiatrist or a general practitioner to rule out seizures, sometimes reimbursement can be like 500 of that. Because we're on the leading edge here, this is not a common procedure. Now, for the neurofeedback, we find that there's 3 diagnoses right now being covered more so that's no longer considered experimental for ADHD, which is great for Pam. It's more considered experimental for substance abuse or traumatic brain injury. So if we have an autistic child and the autistic child has ADHD, well, we'll put the primary diagnosis of ADHD to help possibly get some of the neurofeedback covered.
Awesome. Does it matter if they're asleep or not?
Well, if they fall asleep with the eyes closed, I'll do things to wake them up and have them give me a thumbs up. Eyes closed resting is what we want, but if they get to sleep the night before, it's really okay because that makes all the nasty stuff show up better the next day. If they go in and out of sleep, that's when the transition between sleep and awake, the stage 2 sleep, stage 3 sleep, actually brings out the bad stuff. And so that's not an issue. But I did have one child the other day fall asleep with his eyes open. That was kind of weird though. Not too many of those.
Yeah. Okay. So we're wrapping up here pretty soon. Again, a reminder to make sure that you attend the event and to send you any additional information after this. Please make sure that you put your name and your email in the chat box so that we can capture your attendance today. Whatever email you use to register for this event would be great. We really appreciate it. In order to keep having these events, we need to know who's attending. So really important to us. I really appreciate your patience with that. I'm going to actually, I have to jump off of here. So I'm going to turn it over to Stephanie to ask the remainder of the questions. Feel free to jot them away in the chat. I know Dr. Ron loves answering your questions, and he's a wealth of information. I so appreciate it. Thank you.
Bye, Elizabeth. Okay, Steph, what else do we have?
All right, let's see. We have some people putting their information in. Had somebody ask a number of years ago, I had an EEG that diagnosed me with seizures that was not evident in my behavior, so the EEG was repeated and I tested normal. Could that have been an indication for another issue?
Well, again, having a neurologist office do it and who actually did the read on it could have saw the seizure activity the second time and just not called it because it didn't meet their threshold to be a. But isolated epileptiform discharges, paroxysms, sharp and slow activity is an abnormality. And when we can relate that to a problem in the person's life via where is it hitting in the brain? You know, if we have a seizure and it's discharging in the left posterior temporal, we better see something along the line of language issues. If we see it in the right frontal, probably the worst place to see it. And that can a lot of times be a head injury or not. And this would usually be the aggressive behavior, the impulsive behavior, the alcohol, drug addiction, and everything else part of the brain. But there's really on where we find, but we do have to find a clinical correlation, because I had one of my therapists, she came in and she had these discharges, these spiking waves all in the back of her head, and she had no symptoms. And what do you do when you have an electrical abnormality and no symptoms? You don't treat. 3 years later, she comes back. She's still working with me, and we do another EEG and find out that she has no more spike and wave activity in her brain. How did that happen? Well, it just so happened that she was on a IUD with birth control, first one, and without birth control on the second one. So we found a link to certain birth control hormones that are actually causing brains to go wacky. And OBGYNs know about this too, but they've never documented on why it makes people feel so terrible. So it could have been one of those situations as well, a hormone issue. So it's just hard to say.
Okay. All right, thank you. And do you work with patients with hemiplegia?
With what?
Hemiplegia?
Yeah.
I'm saying it correctly.
Now there's not much research out there on Parkinson or hemiplegia or some of the gene issues. Of this, we're starting to get a lot more information in now on neuroinflammation, and there may be some connection in that. And yes, my Dr. Melissa Jones, who's our pediatric neurologist, she wrote this the other day and put it onto our Instagram, or allowed us to put it onto our Instagram. I thought it was really great of her. If I can find it. I was trying to teach me Instagram. She said, healing the brain needs to be approached from multiple angles, and an accurate diagnosis, removing toxins, reducing inflammation, appropriate medication, and neurofeedback. Doing one without the other only is treating part of the problem, and the true healing is less likely to occur. So that was a heck of a from her. And so that's what we want to do. We're looking heavily into right now. I'm going to be doing a presentation for a conference on neuroinflammation and neurofeedback and what we can do. Neuroinflammation is also what we're having in COVID right now. And COVID, you heard of COVID brain. This is real, and not just in a small part of the population. Like we were first told, it looks about 33% have some neurological abnormalities, neuroinflammation. So number one, let's get the inflammation out. Let's retrain the brain to bring these brains back, because cognitively they've got therapists out there right now that are disabled because their brain's just not functioning. So if anybody knows anybody with COVID or having this COVID brain issue, that would be a good referral to let us come in. We're actually doing a national study on COVID right now with the EEGs.
Okay, thank you. Any final questions? I missed it. Please let me know. I think I got all of them.
Well, I just appreciate everybody coming and attending things. You will be getting a copy of the YouTube video that will come out, and feel free to share this with your friends and everybody else. We'll keep you signed up for the next one and let you know, they'll give you the link and the flyer for that comes out. And I do like to make myself available. I drive home to League City from down here at Kirby, just north of 59, about 3:30 o'clock every day. And I here do a lot of my phone calls with parents that just have questions. So I'll be glad to, at time, I'm driving for about 40 minutes, but just on the road with hands free. So I like to do my business on the phone rather than sticking up here at the office for another hour. But anything that, just let me know. I'll be glad to help you through it.
Okay. All right. Well, so much. Just letting anyone. Okay. So Dr. Ron did put some information in the chat. So please note that he did put a link about neurofeedback in the chat, as well as contact information. So if you would like to grab that, we will keep this open a little bit, so you'll be able to take a look and see. But go ahead and get in the chat. Otherwise, thank you, everyone. I really appreciate everyone joining and taking time. And thank you, Dr. Ron and Alexandra and the rest of the team for helping set this up. We appreciate it.
Yeah,
And
just stay safe.